Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Tuesday, May 26th. We enter a 3-day weekend, so let's jump in and look at the graph on what's happening in the 8 counties. We can compare Friday to Monday and see what happened over those 3 days. If we look at the number of the people in hospital with COVID-19 in the 8 counties in the capital region, that has dropped from 99 to 96, and the number that are in an ICU is about the same, from 9 on Friday to 10 on Monday. When you look at a graph that shows what's happening inside here in the medical center, you're very familiar with this graph by now. We currently have 45 people in the hospital being treated for COVID-19. We have 40 on the floor, 5 in the ICU, and Fred, we're down to 1 on a ventilator. We'll show that graph in a second.
That's right, just 1.
Over the weekend, we're seeing anywhere between 1 to 3 admissions per day.
And Dennis, of the 45 patients that we have in hospital today, remember 11 of them are nursing home patients who can't go home awaiting a negative COVID test. So they're not acutely ill, but they still are testing positive for COVID.
So therefore, the number of people in the hospital at Albany Medical Center with COVID-19 that we're actively treating for that would be 34.
34, that's 34. Right.
Maybe we should update the graph on a going forward basis where we try to separate out those populations.
I think that would be a good idea. It tells the whole story then.
Let's take a look at the third graph, which shows the number of the people in the hospital inside Albany Medical Center on a ventilator being treated for COVID-19. And you can see that number, again, is down to 1, and you can see how high it was in the past. So that's remarkable work, and hopefully soon we'll say 0.
I hope so. Really a huge change, very important.
Fred, how many people in the region are on ventilators?
So Dennis, as the audience knows, we have a call every morning, and this morning that number was 7. Remember, this is 12 hospitals as far away as Adirondack Medical Center in Saranac, all the community hospitals around us, and the VA. 7.
So 7 among those hospitals, and at our high water mark, we were probably over 50 for the whole region.
Oh, well over 50.
Well over 50.
Yep.
We started a pilot last week. As mentioned, we were one of, I think, 16 hospitals in the state that was allowed to have visitors come through and visit people in the hospital. And let's get an update, Fred.
So our visitation now has changed such that we're allowing patient visitors from 4 to 6 p.m. every day. You have to register before you can come, and you have to be temperature and symptom screened at the door. You have to put a mask on. You have to perform hand hygiene. You can only go to the patient's room, and when you're done, you need to leave the building. We don't want you going to other areas within the building. So over the weekend, we've had between 70 and 100 visitors each day.
Nice.
It's worked well. I will say that right at 4 o'clock when it starts, there's usually a line. We have little marks on the floor for people to stand, but it takes maybe 20 to 30 minutes to get in. But it's important that we do this right so that we don't either infect those visitors or have those visitors infect staff or patients. So it's working well, and we're going to continue to see how it goes this week.
And that's consistent with the theme we've said all along, which is that as we're reopening things, we're going to do so in a manner that is safe, whether it be testing people before surgery for COVID or allowing visitors on the campus in a way that's safe.
We're doing this in a very organized, careful way. Absolutely, Dennis.
And to that point, we received a very nice letter from somebody who wanted to share with us her experience here on the campus. Forgive me while I look down and read this. This is from someone named Denise. And Denise has medical conditions that require her sometimes to come into the hospital, both on the inpatient as well as on the outpatient side. She said, I've only been in 3 places other than my home since March 13th. So she was obviously remaining in home. And all of those places have been Albany Med Clinics or the ER. So the only place she came was here. I have felt safe at every visit. She goes on to say, please don't avoid care if you are in need of medical treatment. So here's a consumer of medical care who said the only place she's been is the hospital, and she feels very safe here. So I think that's a great message to our staff that they're doing a wonderful job keeping the place safe.
They really are, Dennis, and I think it's a very important message to get out to the community. We are doing everything possible to keep our staff and patients safe.
Last week, we celebrated the graduation of our medical students, and they're on their way, and we wish them well. Some will stay here. We look forward to working with you. But academic years have a cycle to them, and so there's going to be new students coming in here very soon, new learners, medical students, and residents. And we have learners who are from Albany and who've been in school in Albany, and we also have learners who come from all around the world. In order to handle new students coming in, our college, Dr. Verdile, and our epidemiologists work together to come up with a plan. How are we going to handle new students, Fred?
So Dennis, new learners coming into the institution are going to be required to wear a mask for 14 days. That's the incubation period of COVID. So we think if they mask themselves for 14 days, after that period of time, they're like all the rest of us in this community in terms of exposures. So all students, all new residents, as they start in June, will be required to do that.
And the theory was, regardless of where they come from, that way you can't differentiate someone who may be from Albany but may have traveled to New York City, or someone who is from another part of the world. They're all going to be handled the same way.
That's right, Dennis. It would be hard to track everyone and be absolutely certain of their travel. So to be safe, they're all going to wear masks for that 14-day period.
And what I didn't hear you say is they're not going to require a COVID-19 nasal swab, and they're not going to require a serology test.
We don't think there's value to either of those. If they are careful and wear their mask for 14 days, that is more than sufficient to prevent any transmission of illness.
Okay, very good. Very interesting, and of course we look forward to the new students coming in.
Yes.
I think that'll do it for today.
Yep.
Okay, we're back at business here. We'll be back again tomorrow. We'll have some other updates from the medical center for the rest of the week. We ask that you please take care of yourself, take care of others, and we'll see you tomorrow.